My name is Osina Tuzaina Biansane. So my colleagues and I will be administering on the topic communication within intensive care. So first and foremost, it is quite important to know that ICU is administered to patients who are in complex medical situations, and it is also important to know that it's only applied to individuals whose life is under threat. So in ICU, complex applications are made in this unit and high technologies are used. The intensive care unit is a high depersonalizing unit. That means a person can feel unwell, can feel so detached from their identity and their real self. Oh, firstly, we're having a situation where there is a need for urgency and attention to an individual who had just fallen into a massive accident.
Hi, I'm Nurse Hanan. Today I'm going to tell you how to deal with a patient with a communicate with direct ICU patient. Hi, I'm Nurse. I'm going to talk to my patient to see how my patient feels. Hi, how are you? Okay. Can you tell me your name?
My name is Sam.
Okay, I will be your nursing for today. I would like to check your identify. That's on my right patient. How are you feeling for today? Are you feeling better?
Yes, I'm fine.
Okay, I will check your radiation pressure. I will check. Okay, how are you feeling now? How you feel? You have any pain in your body or where are you having?
Right now, I will show you how to communicate with indirect patients in ICU. So, firstly, we create privacy, and of course, perform hand hygiene, and then it is always important to introduce yourself to the patient, because since we are dealing with patients that can't speak directly, there are several ways of doing that. Anyways, of them introducing themselves. So, hello, my name is Osinatu. If it's necessary, if the patient can hear exactly what you're saying, and then you can just identify the patient by asking them their name. But for an indirect patient, you can just check their handband for their identity, so you confirm whether they are your patient or not. Okay. So, secondly, we can just, if it's necessary, to check vital sign of the patient. It is very important as a nurse dealing with ICU patients to know that when it comes to indirect patients, since they can't speak, there are several ways of communicating with them, and first and foremost, you can just ask them to, because they definitely hear when you speak, to blink their eyes or their fingers, and then, or in a station of yes or no, you can just maybe flip up cards to know what's going on with them. For an example, you can just ask now. So I know you are unable to speak, but how do you feel today? If yes, can you give a tone, please? Okay, so this is an example of dealing with indirect patients. They can just say yes or no with the flip of their hands, their eyes, or cards. Yeah.
and a friend who may be very anxiety or frustrated. Don't assume that intubate patient cannot communication. Never assume that the patient cannot hear or compare what is said is here or his presence.
First, environment factor prevent communication, a sound made by the device. Second, large number, several person conflict input-output. Third, failure to understand the difference between the day and the night.